Bishop Smith, my nephew Matthew signed letters and wrote letters to seniors over like yesterday. I think he came to the church to send letters to the seniors who are shut in. So, he's doing it.
We reach out to 6,000 people every week, those who are part of our church, those who are not, to make sure nobody's disconnected.
6,000. That
we have 100 people that's doing 50 calls or something. Yeah, we do 6,000 a week, and we rotate.
There she is.
There she is.
Are you there, Dr. Peak?
She can't hear us.
I can't hear.
Oh, I heard her. She can't hear us.
Did? Okay.
I heard her say hello.
Dr. Peak, can you hear us?
Doesn't look like it.
And my screen says you're on mute, so I don't know if that's helpful at all. But we probably need to get started as soon as we can get her audio working, because it's 2:03. Cheryl, I'm going to take myself off of video.
Okay.
Here, and I'll go off mute as soon as I can, as soon as I make sure she's okay.
Okay. Well, let me know when I should go.
Okay, yeah, give it a let's wait for her to come back in. And then you'll hear Cheryl start to wrap things up. And then when she says her final goodbye, if you could just look straight ahead at your cameras, I will end the meeting for everyone. You don't have to worry about that. But just, it'll look better on screen if everyone's kind of looking forward, kind of acknowledging the final remarks.
Now, is my head cut off, or do you see?
Does Cheryl look good?
There you go.
There you go. No. There you go.
Good. Okay.
Dr. Peak, can you hear us?
Deanna, do you think that Esther will join us? Should I introduce her or no?
You know what? Why don't you, you can mention her, make her bio the last one.
Okay.
And then say that she may not be able to join us after all today. And then this way, if she does, she was introduced and you can just keep going. Dr. Peak, can you hear us?
It said she left. It just said she left. So.
And you want to get started, Cheryl, and then just have her as soon as she comes in, because I'm going to get off audio now too, because we need to get going.
Yeah. Let me know when to go.
You can start.
Good afternoon, everybody, and welcome to ABC 7's continual digital series, Town Hall Meetings. And today is going to be a very special edition of our Chicago Voices of the Community. Today, we will be talking about the COVID conversation and the upcoming vaccine. As we know, hope is on the horizon. We are in a critical countdown of perhaps the distribution of the most complex and historical and ambitious vaccine in American history. So today we will discuss late breaking news on the FDA discussing and having the important conversation about emergency use of the Pfizer vaccine here in the United States. Also, we'll examine the mitigation safety concerns, as well as efforts to distribute with equity here in the state of Illinois, as well as dig deep and dive into the historical concerns about trust and confidence when it comes to Black and Brown communities when we talk about medical research and vaccines. We have gathered today, I'm proud to say, one of the most impressive panels of scientists, community leaders, doctors, religious leaders, and also political leaders to talk about the importance of this vaccine, the campaign, the rollout, why we should get it, who's getting it, are you going to get it, how it's going to happen, are people afraid to get it, and what about the safety and the efficacy of this actual vaccine? So let me introduce to you this esteemed panel on this Thursday afternoon. Dr. Richard Novak is the head of the Division of Disease infectious diseases at UI Health. For 35 years, he's been teaching, researching patient care. And of course, he has been awarded the best doctor in America since 1998. What an awesome honor there. And he's also the lead investigator in 2 vaccine trials at UIC Health, one involving Moderna and one involving Janssen. We'll talk about that and some of the participants we interviewed earlier this week about why they were involved in these vaccine trials. Also joining us this afternoon is Dr. Bishop Horace Smith. He has treated the bodies of souls for over 40 years, recognized worldwide as the pastor of Apostolic Faith Church. He is also an attending physician in the pediatric hematology department at Ann and Robert Lurie Children's Hospital. He is the author of the bestseller book, Blood Works, the Insights of a Pastor and a Hematologist into the Wonder and Spiritual Power of the Blood. Also, State Representative joining us from the 5th District, Lamont Robinson, a businessman, a professor, a director, a youth mentorship, a lifelong public servant, and we thank him for his service. He believes that everyone has rich potential and everyone should have the opportunity to live their full potential. I like that method and model. Also joining us is Dr. Suzette McKinney, CEO and the Executive Director of the Illinois Medical District. She oversees the implementation of the organization's strategic plan of economic strategy and development for the Director of the Medical District. She is also a former Deputy Commissioner of the Chicago Department of Public Health, and she is the operation lead for the alternate care facility at the Illinois State COVID response team. And Dr. Monica Peak is joining us. She specializes in general medicine, preventive health for adults, specializing on the focus of reducing healthcare disparities, and concentrates on diabetes and breast cancer screening education for African-American patients. Now, at the University of Chicago, she also explores how racial and cultural barriers impact a physician and patient relationship. And joining us later on is Esther Corpus, the Chief Executive Officer, CEO, 30 years in the healthcare industry with community health.
I cannot unmute
Hospitals,
myself.
and she's the lead supporter for
My screen says that I'm not muted.
legislation that requires healthcare institutions to provide trained.
I've come in and out several times.
And she's also the lead engagement in civic community outreach. Thank you so much, everybody, for joining us here on this Thursday afternoon for this very, very important topic. We're going to go straight to Dr. Novak because he's been on the front line, on the ground, working on the Janssen and the Moderna trials. How does this work, Dr. Novak? Explain exactly how it works, how you get your and what you look for in these trials.
Okay, well, as you may imagine, there was a tremendous amount of interest in these vaccine trials when they're being announced. And so it really didn't take a tremendous amount of effort to find people who were interested. We mainly did it through the media. We had a presence in the media, and we announced ways that people could contact us, and we created a registry from that. And very quickly, we had about 8,000 people who were interested in being in the studies. So it was a big interest of ours and mission to include largely racial and ethnic minorities in our study because, as you know, racial and ethnic minorities are overrepresented among the people who are getting the disease, and they do more poorly when they do get it. So it was very important that Black and brown people are included in the trials, and so we made a big effort to recruit in those populations. And actually, in the Moderna study, about 75% of our cohort was racial and ethnic minority.
You also talked about treating the elderly, but how does it actually work when people are concerned about taking or being a part of a trial? How does it actually work?
So these studies are double blinded, which means that nobody knows what they're getting, and none of us know what we're giving, and they're placebo controlled. So in these studies, half the people get the vaccine, and the other half get a placebo, which is, in this case, is salt water. It's something that's inert that doesn't have any activity. And they're randomly assigned to one or the other. So it's really just a random number generator that determines who gets what. The reason for doing all that is to eliminate any kind of bias in the selection of participants, and if we don't know what people have, then we can't influence the outcome in any way. That's the way medical clinical research is supposed to be done, and that's the way these trials have been done.
And Dr. Novak, as we speak and we've gathered this prestigious panel, the FDA is now having discussions to approve the emergency use of the Pfizer vaccine. How confident are you that this is going to work?
Well, I am very confident it does work. I mean, the studies have shown that. So let me tell you why. There are two studies that are going before the FDA today and in a week with Moderna. They're both mRNA vaccines, which means they're very similar. It's a newer vaccine design, which is basically the genetic code for a part of the coronavirus, the part that we want the body to make an immune response to, and they're using almost identical designs and almost identical parts of the virus. And they conducted two independent studies. In case of Pfizer, they enrolled 44,000 people in a trial. And in the case of Moderna, 30,000 people. The studies were run independently, and they came up with the almost identical results. That is incredible. And it's a testimony to how believable the results are. I mean, that you can't just come up and make that up. I mean, it's just the fact they both came up with the same result with very similar vaccine designs speaks very strongly that the vaccine results are very believable and real.
So while Dr. Novak believes, and he's very confident that it will work, let's talk about those people who are concerned that it might not work and the way that they've determined that it will work and how they did their research. Now, a poll from the NAACP recently said that 14%, only 14% of African Americans will get this vaccine once it is approved, and only 34% of Latinos. So let's talk to Dr. Bishop Poor Smith, who has a megachurch, who has a huge congregation, who is also a medical doctor. The struggles of getting your congregation and people of color to find interest in taking this vaccine.
Yeah, Cheryl, and to the panel, I think Dr. Novak gave us the outline of why we should have great confidence in the methodology that was followed by this vaccine. Even though they use a name called warp speed, I guarantee you they did not cut corners, whether it's safety, whether it's efficacy with these vaccines. But let's go back a little bit. The issue that we're facing with those surveys by the NAACP and others are because there is mistrust in minority populations, in the medical institutions in general, in government institutions because of the politicalization of this whole pandemic. And so not only African Americans and Hispanics, but even others in recent surveys have showed some reluctance in taking the vaccine. Now, having said that, there's other cultural and historical reasons. People always cite what they call the Tuskegee experiment, which I stopped using that name because I think it again reinforces mishistory. The experiment done in 1932 that was done at Tuskegee was not done by Tuskegee. It was done by the U.S. public health system.
Yeah.
The U.S. government constructed, and our health professionals constructed the clinical trial, did not let those participants know that they were positive for syphilis, didn't give them syphilis, but didn't let them know they were positive, and then had treatment and did not treat them. So there is a historical context. But having said that, that's 70 years ago. And since that time, I have personally been involved in others in making sure that those kinds of things are not repeated, that there are safeguards to make sure that clinical trials are, again, integral. So back in March, I encouraged my entire congregation along with all those that I knew across the country, that we should participate as minorities in the clinical trials. And my reason is this: there are medicines today that don't work as well in us because we did not participate in their development. I do not want this government to put billions of dollars toward vaccines and other companies and we not be involved in it, because doing it that way, I think these new numbers of efficacy shows you that because you were included, that we have a high degree of confidence that these vaccines will work, and they do work. There is no conspiracy. I told people I will be first in line to sign up for a vaccine, because in my understanding, in this terrible pandemic, you're going to either get COVID or the vaccine. And even those who are talking against it, you watch in a couple of months, they're going to be asking the alternate question: why is it taking so long for me to get the vaccine? Because without a vaccine, no human being has immunity against COVID. That's just the reality of the pandemic, that the immune systems that we have, they work, but they have never been exposed to this novel virus. So it is incredibly important that African Americans, Latinos, and others are not again behind the 8 ball by being given misinformation and waiting to get the vaccine. And we all know this, unfortunately. While we're waiting, people are dying. So I think it is urgently important to get accurate information and to use trusted voices to say that and why they should say it. Because people should not be herded into these vaccines. They should be explained why they were developed, how they were developed, and why they are safe for all of us.
Well, we are nearing the 300,000 mark in deaths here in the United States. And Dr. Anthony Fauci, who is now the chief advisor, the chief medical advisor for the Biden-Harris administration, said that he was going to try to gather celebrities and maybe influencers. Even former presidents have said that they would take the vaccine perhaps on television so people can see. And Dr. Fauci also wanted to let everybody know that one of the top researchers who developed the vaccine is an African-American woman, Dr. Kizzy Corbett. And so he is trying to get the word out. But Dr. Peak, you have done research and you have done studies on how and why people do not participate in trials, and the importance of having a physician who's treating you, look like you, sound like you, speak the language that you speak. Talk about the importance of that. I saw you shaking your head quite a bit, Dr. Peak.
Oh, can you hear me?
There's a little reverb in that. But can you talk now? Are you able to answer the question perhaps now?
No.
Go ahead. Hear you good
Okay.
now.
Okay, so let me try. I'm having technical difficulties. I will say that just like Dr. Smith, he is a trusted person for several reasons. Not only is he a medical doctor, but he is trusted in the church space. And what we know is that people who are in marginalized communities have more trust with physicians who have the same social identity. And so it's important that those of us who have a shared experience, I'm getting a message to mute one of my devices. Well, okay, let's see.
Well, Dr. Peak, we're going to go around. We'll come back to you when you kind of determine how everything is working out. So Dr. McKinney, you know, we're talking, of course, to Bishop Smith, Dr. Smith. In the African-American community, we tend to pray everything away. That is kind of how we approach a lot of things. We have a problem with cultural confidence, and we have generational trauma that we've been dealing with so many decades. Now, when you rolled out that alternate care facility back in March, that was a huge and massive undertaking. We are now about to undertake perhaps one of the most ambitious rollout for this vaccine. How important is your involvement in making sure people are confident that it arrives with efficacy, because it has to remain at minus 94 degrees and all of the factors that go into it? What is your campaign to give people confidence that the rollout is going to be a good one?
Sure. Cheryl, thank you so much for the question. You know, I actually received that question quite a bit from members of the community and from those that I come into contact with. And of course, I always get the myths and the things that people remember from years past. But what I explain to people, just like Dr. Bishop Smith said, number one, we have to be involved in these trials so that we can ensure that the medication will work for us. Number two, I understand, having come from these very communities that have such significant concerns about vaccines and new medications, I understand those concerns, but I often explain to people, we have to be informed consumers, you know, and so it's very important for members of the community to stay on top of the information that's being distributed, to read and research on our own so that when we hear information, we understand where that information is coming from. And if I could just add one thing to what Bishop Smith was saying about Black and Brown communities being involved in the development of medications. For the last several years, the National Institutes of Health have had a program that was centered around getting a large array of residents, of members, people living in our country, Black and Brown communities, members from all racial and ethnic backgrounds and ethnicities to participate in programs that increase their representation in clinical trials. And so when I'm speaking with community members, whether it be in my context of working with the state's COVID response efforts and the alternate care facilities, or if it's in my capacity at the medical district, those are the things that I'm talking about, how important it is for us to be involved, to be educated, and to be informed, and to act from a position of knowledge.
Well, Dr. McKinney, it sounds easier said than done. So Representative Robinson, what are you doing? What kind of campaigns are you rolling out? This is a community-based effort that has to get the word out. So what are you doing in your community, and how are you working with other community leaders to make sure that there is a comfort zone when this vaccine has been approved?
Cheryl, thank you for the opportunity to be on this esteemed panel. And as always, we mentioned a little earlier, Reverend Smith's titles. Dr. Smith mentioned reaching out to his constituents. I'm very fortunate to have volunteers that reach out to the seniors in my district to make sure that we understand what their needs and concerns are. And this is part of the issue. But I'll tell you, the biggest challenge that I'm dealing with right now, Cheryl, is the closure of Mercy Hospital.
Yes.
Why is it important? Yeah. Mercy has, and Cheryl, you are a Southsider, you understand the importance of Mercy Hospital. Yeah. For 100 years, Mercy has been caring for the African-American community. And so in the midst of a pandemic, to close an institution that we trust as we await this vaccine is very troubling. And so I've been working with my colleagues in Illinois Black Caucus, as well as other members in the General Assembly, Black elected officials that touch Mercy Hospital to stop the closure. Fortunately, we have not gotten much support, but we continue to push. We continue to have faith that receiving this vaccine. We already mentioned the uncertainty that the African-American community has around vaccines, which is why it's important to have Mercy Hospital remain open, because our community is comfortable with the physicians that are at Mercy. And so when we are talking about educating and getting the word out on the vaccines, we need to make sure that we trust our medical providers that we've been going to for several years. Our mothers, our fathers, our kids, you know, it is a family hospital. And again, that is the biggest concern that I'm having, also knowing that when this vaccine comes out, will folks, low-income folks, particularly in my district, be able to get the vaccine? Will they be educated about the vaccine? And that's why it's important, again, that we keep this institution open.
Now, Mayor Lightfoot yesterday said that she is hoping by 2021, the end of 2021, everyone will be vaccinated at no charge. But Representative Robinson, how are you working to convince your constituents? Because we've interviewed so many people who said absolutely not. I mean, in your district, we've gone in all of the communities and we've been asking, and so many said they're just not even, they don't even want to hear about it. And you've
Cheryl,
got
that's
Mercy Hospital closing, a place where they found a comfort zone.
and Cheryl, that's where it comes to being a full hard press, bringing in folks like Dr. Smith, who has been a beacon for our community. He is someone that we trust. We have to be able to take the Dr. Smiths of our communities to be able to let our community know that this is something that is safe. Unfortunately, as an elected official, we have not done that, and we have to get with the mayor and the governor and let them know that we have to use our pillars in the community. We have to use elected officials like myself. We also have to use folks like yourself, Cheryl, and Pastor Smith to be able to get the word out. And unfortunately, we haven't done a good job doing that. We have daily press releases or daily press conferences around COVID, but we haven't been able to get people that look like us into our communities on TV to talk about this vaccine. And so that is key, Cheryl. It's going to take all of us to be able to make sure that our people are safe and secure.
And I'm grateful that all of you have joined us on the panel today. This, of course, will be at abc7chicago.com. So future generations can read this and listen to it. And also family and friends can gather and talk about it and discuss it. Dr. Peak, if you are back, I'd like to ask you about the ethics about this and the black market. Some people are saying rich people will be able to get the vaccine quicker, the best version. And then some people, you know, the black market, of course, will be able to. And then, you know, it's out there in the discussion. So how, and the ethics about, will now have to carry a card saying that you've been vaccinated, like a social security card. Can you be treated differently at your job, or will you not be served at a restaurant if you don't show that you've been vaccinated? So let's talk about the ethics, Dr. Peak.
That's a great point. And Chicago is rich in bioethicists who have been thinking about this issue for a lot. And I've been one of the people who've been thinking about how we roll this vaccine out in a way that is fair and equitable, taking into account the fact that some people are at higher risk than others. And so that's one of the reasons that physicians are first in line, is because we care for people who are sick. And I think that that actually has a double effect, in that it shows that scientists are willing to stand up and say, we really think it's safe because we're going to take it first. So I think that that helps us put our money where our mouth is. But the other thing is that we have to think about equity as a cross-cutting thing, that those who are at the highest risk, the most socially vulnerable, those communities who are made up of essential workers, those who are at increased exposure, at higher risk for disease because of where they live or how they're living in overcrowded conditions, those are people that we have to protect the most. And so for every group, for every category, for every tier and wave as we roll them out, we have to think about the people who are most likely to get sick or infected and prioritize those people too. So there is an organized way that we have thought about how this should be implemented, but it should not be a black market of vaccine, where we specifically have done this in a way that it is to avoid the Donald Trumps of getting this first. We've seen that happen with the monoclonal antibodies, the presidential cocktail. That's not gonna, that should not be happening. And because we know that people who need it are most afraid of it, and those who may be less in need are going to try and grab it first, we have to have a system that's fair. And so what I am hoping and praying is that we can get the people who really need it the most to step up when it's their turn and say, yes, I will take this vaccine. And actually this morning, I shot a video to try and encourage people in the community to do that. And I said, you know, I'm taking the vaccine when it's my turn for the South Side community.
That's a very powerful video. And of course, you can be what you see. And so when you post that video, Dr. Peak, you are likely to address people that maybe was a little bit afraid of doing that. And Dr. Novak, you've done extensive research in the trials in HIV. And I read something about where you said that back then there was social injustice and poor and low income communities were affected on treatment and trials and research. So talk about how learning about working on the HIV research helped your process in this new vaccine trial participation.
Sure. Well, HIV particularly affects marginalized members of society more so than coronavirus does, because that affects everybody. And so there's tremendous stigma involved with having HIV and therefore in participating in HIV research, because people are afraid that they would be outed about their HIV status if they're participating in research. When you participate in an HIV preventive vaccine trial, which we're actually conducting still, it's aimed at people who are at risk for HIV but don't have it. And the vaccine has the possibility of making their HIV test look positive because they're inducing an immune response to HIV. So people will be afraid of being in the study because then they may be misconstrued as having HIV, which is very stigmatizing. It was interesting to me when the coronavirus pandemic began that I started to see some of the same stigma occur in people who had coronavirus. And there was a parallel that it came back to me from the early days of HIV, that people were afraid of their neighbors and family members who had coronavirus, and they would isolate them or ostracize them or make them pariahs. And even after they had recovered from their coronavirus, they were still shunned by their family. And I remember that well from the HIV days.
Well, Dr. Novak, talk about the efficacy and the concern that in the transportation process, now we know once it's approved, probably it will start shipping out in 12 hours from the Pfizer headquarters out in Kalamazoo, Michigan. But can it arrive and will it work by the time it's administered? And this Pfizer shot, you need more than one. And some people, will they take one and maybe not come back for the second one?
Well, all those are all concerns that you bring up, and there's been a lot of preparation in terms of shipping the Pfizer product to make sure that the cold chain can be maintained. It's going to be distributed out of medical centers that have the capability to store it, because your average community pharmacy doesn't have a minus 80 centigrade freezer that they can store the vaccine in. So really large medical centers have that kind of equipment and are able to store it. So the Moderna vaccine doesn't have the same onerous storage requirements that the Pfizer vaccine does. It'll be a little bit easier to distribute. And I think the biggest problem is going to be supply, frankly. There's just not going to be enough vaccine to go around. And even though there's going to be considerable fear about getting the vaccine, the initial problem is just that there's not going to even be enough for the people who do want to get it. I think it's critically important that we continue with the other vaccine trials that we're conducting, because we need more companies in the game, frankly. We're in the process of doing the Janssen vaccine trial, which is the Johnson & Johnson product. That's a single dose vaccine, and it has much easier manufacturing. It's easier to manufacture, it's easier to store and ship. And so if it proves to be equally efficacious, it'll go a long way towards increasing our supply and being able to distribute it. There's been a lot of press about the AstraZeneca vaccine, which is still in trials here in the United States. There's information released about it. The trials are done elsewhere in the world that are somewhat confusing without going into too much detail. But the trial in the United States needs to be completed. Despite the results that have been published, it's probably an effective vaccine. And the big advantage of it is it's very easy to manufacture, and the cold chain requirements for shipping are really minimal. So it's very easy to distribute. And I hasten to say it's dirt cheap. even though in our country, the federal government said they're going to pay for everybody to get vaccinated. That's not true worldwide. And this fact, the AstraZeneca vaccine is only going to cost $2 or $3 a dose.
All right, so Dr. Bishop-Smith, you were shaking your head quite a bit when Dr. Novak was commenting. Some people, of course, their side effects, we'll get into that a little bit later on, but Dr. Bishop-Smith, what do you tell your congregation or people that you know when they simply say, I'm not going to take it? What is their reasoning? And then how are you going to convince them when they see that 2 healthcare workers had an allergic reaction, even though they had allergic reactions to other vaccines? But how effective can you be when people are scared?
Yeah, they're scared, but they also understand their vulnerability. You know, I caution people about panaceas. There are none. Yesterday, you quoted this today that 3,000 Americans died yesterday from COVID-19. These are real numbers. These are real people. So if thousands are dying every day, and we're all vulnerable, I say to people who don't want the vaccine, all right, let's, for discussion's sake, talk about that. What is your alternative? And there's silence, because the truth of the matter is, and here's where trusted voices must be persistent and must be patient with people, but to explain to them that we're all vulnerable. This is the truth. Our immune systems are not prepared to deal with a novel virus. That's not going to change. So we're going to be vulnerable until we develop antibodies against it. And you don't want to take the risk of getting COVID and hopefully having a mild case to develop antibodies. Because again, we don't even know long-term from the vaccine or from natural infection how long it's going to last. So your fears will not protect you. I say to my church, you can be afraid, but your fear won't protect you. Your fear will only keep you where you are. And where you are right now is where we all are. We are vulnerable. That is the truth. And I think that even these numbers about those who refuse to take the vaccine, I am confident that we're going to see, unfortunately, that when they see others getting the vaccine and doing well, they're going to say, as Dr. Novak said, where's my supply? Because here's what I was shaking my head. You know, I'm one of those guys that live way up in the sky. We must have more companies developing vaccines to have enough to vaccinate everyone in the world. Every human being needs this vaccine, right? So America has to be very careful in our arrogance, in our prosperity, that we marginalize others who also need it but can't pay for it. I have a concern about that as a churchman. The church cannot preach a gospel of valuing everyone, but practice something that only cares about their own. There's something wrong with that. So we need to be diligent to continually develop other vaccines. And I know there are hundreds of vaccines being developed. We must continue on that path if we can, without compromising those who are vulnerable, because we need a treatment that's going to allow us to have normal life. And for those who are afraid, again, I say to them, your fear will not keep you from getting COVID. And so they have to listen to trusted voices. And then when you see me and others lining up getting the vaccine, watch what I'm telling you. They're going to line up too, because people understand that an emotional fear is real. I don't want to minimize it, but it won't protect you. COVID is not a nice infection. We need to get treated.
And I know that you preach faith over fear all the time, Dr. Bishop-Smith. And Dr. McKinney was really in the chorus while you were speaking. And Dr. McKinney, how do you assure and ensure confidence and comfortability to people, you know, your constituents? I know you made that alternate care facility. That was a huge undertaking, you know, preparation in case. And now this rollout. How do you ensure people how it works, when it works, who's going to get it? And you're involved in the actual overall process. So share with us the confidence level so that people can understand how this will work.
Sure. You know, one of the first things I want to say is when we were originally beginning to develop the alternate care facilities, the reassurance was letting people know that we were establishing those facilities just in case we needed them. But now that we are quite a bit down the line, what I am telling people is that a vaccine is in sight, and we really don't want to have to use these alternate care facilities. If we have to open up one of these facilities, that means that our healthcare system is so completely overwhelmed that there is no other alternative. And at this point, we have an alternative. That alternative is the vaccine. As Bishop Smith said, you know, and as Dr. Novak has also reiterated, there's no immunity in the community. So this vaccine is our only option at this point. You know, people always say to me that they are tired of wearing masks. They're tired of the physical distancing. And what I try to explain to them is those are public health tools and strategies that I like to call non-pharmaceutical interventions. We have to implement non-pharmaceutical interventions when there is no medical countermeasure that will help us develop the immunity and get beyond the disease. So now, if you're tired of wearing a mask, if you are tired of physical distancing, we now have another option. And that option is to take the vaccine. I believe we do have to be confident in what we are hearing from our local leaders. You know, Mayor Lightfoot spoke yesterday about the fact that next week it's anticipated that Chicago, the city, will receive 23,000 doses. And yes, those will be targeted to frontline healthcare workers. But we have to, again, continue to understand the rationale behind the prioritization and to make sure that when it is available to the general public, that we are all establishing, you know, setting up our appointments and getting in line to take it, because that's the only way that we are going to get beyond this. We've seen situations where when the lack of masks, the lack of physical distancing, the large gatherings without any of the precautions being taken, that has caused continuous surges in this disease. So at this point, I believe it's time for all of us to wake up and be smart about this and do what's necessary to move beyond this pandemic.
And we still have to be very vigilant, because just if you get a vaccine doesn't mean you have to stop wearing the mask. We don't know the particulars of how effective it is. So when I talk about, you know, representatives from the community, Representative Robinson, there's talk about mobile units going into communities to actually deliver and administer these vaccines. Have you been working with local leaders, as Dr. McKinney was saying, so that you, in your community that has been hard hit by the COVID disease, you're working on getting the most effective way to get to your constituents?
Cheryl, thank you for that. It's a great question. Personally, what I have done is work with institutions like Christian Community Health, Howard Brown. They have, in my district, Cheryl, goes as far south as 79th and Jeffrey, the South Shore community, along the lakefront to Old Town, Division of Lakeshore Drive. So a very expansive district, high net worth, middle class, low income. I will tell you on in the low income areas that I serve, I was able to, and very fortunate enough to, again, work with Howard Brown and Christian Community Health Center that had several COVID testing in my district. And so that's, again, where, you know, we have to lean on our elected officials to get the word out. We can't wait for the city of Chicago or the state to do things. We have to work with our local leaders that have their ear to the ground, their eyes on the street, to be able to make sure that we protect our folks. I mentioned to you a little earlier, calling seniors in my district and making sure that we get masks out and other essential items. And so again, it's going to take all of us to be able to beat this virus. And so again, I'm fortunate enough to have worked with institutions to be able to get testing done. And I will continue to do this as an elected official.
That is so important, because it's going to take everyone on this panel here to make this happen. And Dr. Peak, let's talk to you about, yesterday I heard a report where some of the smaller hospitals said that they need help from the larger hospitals so that they can come and service some of the patients. How is this going to work, and does that happen?
Do faculty from larger hospitals sometimes work at smaller hospitals?
Yes, can that happen, especially in this emergency time when that use of cross, help is needed?
I know that that has happened with established relationships, so that the University of Chicago faculty have worked with some of the outpatient clinics that Access Community Health, for example, or other systems. What I don't know is if on an emergency basis, people who have not been otherwise, it takes a while to get credentialed to have admitting privileges or to work at a different hospital. And if there's an acceleration of that process or emergency conditions that can happen where people can just go in and start working at another hospital in a pandemic or a crisis like this. I'm not sure about that. But I do know that we need to find additional ways to increase the capacity of smaller hospitals. What a lot of us have been calling on is for the larger hospitals to open their doors a little more widely and accept transfers a little more freely with an organized system, so that there isn't a lot of excess capacity in one place and absolutely no capacity in another place. And so that's what we're looking for, is a system like we have in place for strokes and trauma, where the whole city has an organized system of care. And so that might be more effective than having individual physicians trying to float around the city, because it takes more than just a specialist physician to care for a patient with COVID. It requires specialty nurses, respiratory therapists, all the physical amenities and other things that go along with that caring physician.
And I know appointments will be necessary, according to Mayor Lightfoot, when the frontline workers and the essential workers who will be getting this vaccine first. I'm curious, Dr. Peak, you posted that video. What has been the reaction and the responses from people who have seen it? Is it effective?
We have not posted. I just took it like several hours ago, and we haven't posted it yet. It's part of the university's effort. So it goes live tomorrow. And we're going to have nurses and people from environmental services, other physicians, all coming together with a message. And that is for initially an internal video, because we again are rolling it out internally to hospital workers first, and then we'll be doing patient facing. And so I will tell you that this morning I spoke to patients, to nurses and other people who work in the hospital who said they were not going to take the vaccine. And so we have a lot of work to do, not just with other people in the community. We have our own selves to convince. And so there's a lot of education and convincing that needs to happen.
So you can understand across the board why people are concerned, why they have fears. But Dr. Novak, we interviewed one of your participants, and his response to why he participated was very profound. He said the alternative for him could be death. And that was a powerful response. He was a 74-year-old man, and we were grateful that he shared with us, because there are a lot of people who are worried about side effects long-term, if they want to get pregnant in a year, because some vaccines that we have taken in the past, you're told not to get pregnant for a year. So some people are afraid to do it, even though Dr. Bishop Smith said it's vital that you do get it. So there's that balance, and how are you doing that? And then yesterday, one of the independent panelists from the FDA discussion for the emergency use of the Pfizer says he feels good about where we are. So the messaging has to be the same, although for some people, they don't hear exactly what they hear. You hear what you want sometimes.
Well, you're quite right. And so, I mean, the truth is that we don't have a long-term experience with these vaccines because they're new. We do, one of the FDA requirements is that there were at least 2 months of safety data on half of the cohort. These are large studies, so it's a lot of people. And the vaccines are actually quite safe in that setting out to 2 months. 2 months is actually an important time period, because 95% of side effects pretty much are contained in that 2-month period. So you pretty much captured them all, and the side effects we've seen are mild. They're and they don't occur in everybody. Again, it's only about 10 to 15% of the people who get the vaccines will have the side effects. They're not unlike the flu shot. Some people get fever and body aches, fatigue, headache are the most common. They usually last for a day or two at most. You take some Tylenol or ibuprofen, and it goes away. And that's really a sign that the vaccine just working, actually. Your body's responding to it. You're getting a bit of an inflammatory response as part of your body making an immune response to the vaccine. Are there long-term side effects? It's really unlikely, but anything is possible because we just not used this vaccine before. But as Dr. Smith has pointed out, you have a choice. You can take the vaccine and accept those side effects, or you can run the risk of getting coronavirus. And we do know the side effects of coronavirus, and there are chronic long-term complications of getting sick. People are having strokes late after the disease, they're having heart attacks, they're getting arthritis, they're having chronic fatigue, and they're
Having
other
amputation.
clotting problems. So you have to ask yourself, should I run the risk of having a shot that's going to prevent that? Or should I run the risk of just getting sick and taking my chances with that?
When you make such a large, go ahead, Dr. Peak, you wanted to comment.
I was just going to say, we are in the middle of a second surge. It's not like it's summertime. The exponential growth of case rates and death right now is ridiculous. This is not the time to be hedging your bets that you are not going to come in contact with the coronavirus. And we've gotten to the point where almost everybody knows somebody who has died or at least had the coronavirus. And if you just think about that person, is this what you want to have for yourself? And as a physician, I have lost several patients to this illness. I have treated several patients, and it was horrible. This is not something that we want to have, and it affects family units. And so you see not just one person, but an entire family that gets taken out, or worse, there's one person left standing and everyone else died. You wouldn't wish this on anybody, and to have people that are still concerned about not taking the vaccine, I do not understand.
Dr. Peak, you're getting emotional, and and you're getting us emotional, and we understand that because we've gotten the call about so many people who have passed on. But what is the root of that? Where is that coming from?
I just care about the people that I take care of. I care about the vitality of the South Side of Chicago. This is where I live. This is where my kids go to school. I study health disparities. I know the injustices that our people have endured and why that puts us at increased risk for all these diseases. And to have a tool that helps us, combat all of these issues, and to know that we're willfully not taking advantage of this, it breaks my heart.
Well, we feel you, and we are all, emotionally drained. We have been through the last 9 months together. I see you, Dr. McKinney. Your face is changing a little bit, and you seem to feel this. You've been through it, to see and visualize a massive alternate care facility with massive amount of beds that could have been filled with human beings. And here we are. So talk about that progress and the hope. And, believe it or not, you guys, our hour is coming to an end. But I would like everybody to go around and give me their final thoughts, the value of the vaccine, their concerns about the vaccine, the importance of the vaccine, the cultural confidence, the generational trauma. Should we, do we, must we? And let's start with you, Dr. McKinney, because you worked at a place where you could have seen beds full of people.
Sure.
And that had to be psychologically draining for you to think of the possibility, how big McCormick Place is. So let's start with you, Dr. McKinney.
Thank you, Cheryl. You're right. I did see a place that we were filling with beds to put patients. And at the very same time that I was doing that work, I was dealing with my own family members, where I was seeing one family member after another come down with COVID, 2 of them with very critical chronic illnesses. And so, in terms of what I would hope for people, and my last message, to people, I would pick up on what my fellow panelists have said today. You know, we are always using Tuskegee and Henrietta Lacks as the reason why we won't act. How long are we going to use those as excuses not to take responsibility for our own health and the health of our community? Let's break that cycle and let's show that we can participate in medical breakthroughs brought forth by technology to help us do better, be healthier, and live healthier lives moving forward. Dr. Peak is correct. We have seen family member after family member, entire family units taken out by this disease. This vaccine is our opportunity to not allow COVID to win.
And my college or classmate from high school was the very first, his sister was the very first COVID death here in the state of Illinois. So from the beginning, it has been personal because I know him and that was his sister. Then he lost another sister right after that. So it's been very personal, I think, for everybody on this panel, of course. And you talked about Henrietta Lacks, and that, of course, underpins a lot of this discussion. But, you know, ironically, the HeLa cells have been used in the most recent application to some of these COVID vaccines. So look at history and look at moving forward and how involved Henrietta Lacks. She's still here serving us. And we are learning from her. And Dr. Novak, you have been working right on the front line. So let me hear from you as a medical expert, a scientist, from a human being who has worked on research for more than 35 years about how this can help save a life.
Well, absolutely. You know, it's probably not well known, but vaccines, you can pick just about any vaccine, and that vaccine has saved more lives than any other medical intervention combined. The vaccines are the most potent way that we can help human beings because, as you know, prevention, an ounce of prevention, et cetera, et cetera. And that's what vaccines are. They're preventing disease. People don't get sick. I wanted to add, because I didn't say it, that in these studies, it was shown that the vaccines were equally effective across all race and ethnicities, as well as age groups. So it was so important that that people of all race and ethnicities participated. So we know that. Now we know that they're equally effective, and so people can take them with confidence.
Representative Robinson?
Yeah, mute.
I would just like to reiterate what Dr. Smith mentioned a little earlier. And our fear cannot protect us. And so I think it's great, Cheryl, that you're bringing us together because you are trusted in our community, just as Dr. Smith is and the other physicians on this call today. We have to continue to get the word out, letting our folk that look like us know that it is important that we take this vaccine. I think it's also more important that we also continue to push. Dr. Smith has been out protesting with me on the closure of Mercy Hospital. We cannot continue to say Black Lives Matter and continue to not have quality health care in the state of Illinois. And so we have to call our elected officials at the top of the chain and let them know our disdain that we want to have quality health care in our neighborhoods and our communities. And then also it's important that we have trusted healthcare providers, which again, why it's important to keep Mercy Hospital open and to everyone to stay well and happy holidays.
Thanks so much. And it's so important to have your physician who is treating you understand your life experience. And Dr. Peak, you talked about that. Your final words on this.
I think I would just echo everyone else's comments that this is, that we're at war with COVID vaccine, with the COVID virus, and that the vaccine is our best chance. That the Black community has been disproportionately hit by this, and that we need all hands on deck and to use every resource that we have to fight this.
You make me think about this nurse from Chatham here in Chicago who got a surprise from Vice President-elect Kamala Harris earlier this week. And she called her, and her response was telling Vice President-elect Kamala Harris that you don't send people and soldiers out to war without the proper tools. So in this respect, it's the same. You don't send frontline workers on to the battleground, as you say, this is war, without the tools to properly fight this deadly disease. And we'll close with Dr. Bishop Horace Smith and his final thoughts on the value of this vaccine and the importance of it.
I want to commend all the panelists, so diverse, and each one speaking from their hearts. Listen,
Yes.
This is not being dramatic. This is life and death. This is life and death. As a physician, as a man of faith, we care about life. And we've got to step up and be mature in this fight, whether it's the closing of Mercy, which is a terrible thing to happen, as the Reverend said so many times. These things are all connected. The disparity in the Black and Brown community did not start with COVID, and they won't end with COVID. I have challenged my friends in high places. I want to see how you act when COVID is over, because these entrenched disparities have been killing us for a long time. We should not allow our fears to perpetuate the same scenario. Life is too precious. Every life is important. And so we've got to take a back seat to our fears and allow these God-given remedies, because of the knowledge God has given us to save lives, to be enacted. If we don't do this, we're giving in again to our fears. Every life is important. I want to say to Dr. Peak, your emotions tell me that you have learned the lesson I learned in COVID. We have forgotten about our common humanity. I don't know what your position is as a doctor, lawyer, Indian chief. It is our common humanity. And these vaccines will give all of us a chance to have real quality of life.
Well said. And we know death is the equalizer. At the end of the day, it does not matter how rich, powerful, influential, death is the equalizer. And speaking of that, the opposite of that is another life, another run around the sun. I want to wish Dr. Bishop Horace Smith a very blessed happy birthday today. You guys, let's wish him a happy birthday.
Happy birthday,
God
Doctor.
gifted him with another trip around the sun, another life anniversary to bless us all with his powerful words of medicine and healing the bodies of souls. You all have been an extraordinary group of panelists, I must say. This Thursday, you have been fuel for my soul. My life has been enlightened. I've learned so much. And, you know, we had to talk about faith over fear. We had to talk about science. We had to talk about possibilities. We saw what could have been at McCormick Place, a lot of hospital beds. We could see something else. We are in a second spike. Your words of wisdom, encouragement, and brilliance will save lives, will change lives, will help lives. And it is my hope that each one of you, after we get off of this panel, that you will talk to one another to see how each one of you can help each other with your goals, helping your constituents and people that are coming into your lives that need your help. Perhaps Dr. McKinney and Dr. Peak can get together on how they can work together, and Dr. Novak and Dr. Smith and maybe Dr. McKinney and Representative Robinson, and maybe they can keep hospitals open and keep them from closing, and who knows what might come out of this. And all of you have been gifted with something that you shared that's been monumental in this hour-long conversation. It doesn't end here. The real work begins after we end this meeting, but you have given us light and hope. Hope is on the horizon. And sometimes at the end of the day in this life, hope is all you have that will get you to tomorrow. So thank you so much, everybody, for your time, for your expertise, for your wisdom, your soul sharing and caring. This is the time of year where giving is bigger and better than any part of your body, because you never know how you can affect somebody you don't know. Dr. Pete got us all in our feelings. And as we know, Dr. Bishop Smith, you know, shaken tenfold, giving is a good thing. It comes back 20, 30-fold. I want to wish everybody a blessed, hopeful, healthy, safe, prosperous holiday season and a phenomenal new year filled with abundant joy and safety and love for others and kindness. So thank you, everybody, for your generosity of your time.
Thank you.
Have a great and happy holidays.
Thank you.
Thank you so much.
All right.
Thank you.